Okay.
Ready to go?
Ready to go. I'm Jennifer Benoit. I'm the Senior Communications Specialist at Clatsop County, and I'm talking today with Dr. Duncan, who has been working with Clatsop County Public Health as the Public Health Officer for 40 years?
Not quite, 37 maybe.
37 years. Well, thank you for talking with me today.
Well, I'm actually a retired family practice doctor, but currently I'm county health officer, which in Clatsop County is a contract position working under the administrator, which is working under the direction of the County Board of Commissioners.
And as the Public Health Officer, what does that entail?
Well, it's mostly advisory to the public health administrator for clinical issues that arise. I basically work with the public health nurses on clinical issues that we get involved in. I came to that story in 1988. Really what happened was the end of the 80s, if anybody remembers, a very famous lawsuit, Patrick v. Burgett, destroyed the Astoria Clinic, which occupied this building that we're in right now and the next one over. So all of a sudden the hospital didn't have any doctors. They were looking for contract doctors. So I came up here. And it was basically a natural fit. I liked Astoria. So for a while there, 1988, I was the jail doctor, the public health doctor, the medical examiner, and a private practicing physician. It got sort of overwhelming after a while.
Can you give us a little bit of background on public health here in Clatsop County?
Well, public health, it actually started at the U.S. Public Health Service quarantine station. Again, a lot of people don't know this, but across the river at, what's it called, Napton Cove, a little quarantine station, and a lazaretto, they call it. It's basically a rooming house. The Sexbarth building was the offices of the U.S. Public Health Service, and they would stop every ship in the harbor here that was going upriver and inspect them for disease, mostly tuberculosis, other diseases too, but they were looking for contagious and communicable diseases. This started in 1899, and if there were diseased people on the ship, they'd move them over in the ship over to Napton Cove, and then they would keep it there, just like they did in the Venetian harbor. And in most cases, they wouldn't just wait till everybody died. They'd take them off, treat them the best they could. If they couldn't really treat it, they'd put them in this lazaretto. They'd quarantine the people on shore in the quarantine huts across in Napton Cove. They'd take all the people off and fumigate it to kill all the lice and the rats and everything on the ship. And when the ship was clean and the people were healthy, they put them back on the ship. Even in 1899, they didn't have much that they could offer medically. Mm-hmm. It was, again, mostly control measures, keeping people separate, take out the sick ones. I mean, a lot of those people would die. They would have end-stage tuberculosis, or they would have, I don't know that they had plague. They had other rat-borne diseases like typhus and so on. Yes, it was effective. I mean, that's all they could do to keep epidemic diseases out of the United States was to stop them at the border, take out the sick ones, fumigate the ship, put the healthy ones back on.
How would you say the health department has evolved?
Now, the health department has undergone enormous changes. Back in the day when I started, public health was actually had a lot of clinical roles to play. Because this was before Medicaid, and there were a lot of people who didn't have doctors. So the public health departments in bigger counties, and even this county, had a small clinical practice, just kind of basic medicine for people who were really unable to get care anywhere else. The hospital ERs weren't staffed with doctors, but if it was an emergency, they would call the doctor on call, and that doctor would come in. So at that time, the health department ran a little clinic. They ran an immunization program, and then, of course, STD clinics, the sexually transmitted disease, and other communicable disease. That was a big issue. Anyway, the point of that is that public health has gone from basically a hybrid thing, one being the environmental health kind of things, and preventive medicine, and home health, direct medical services. That was all part of public health. And a lot of that's been kind of turfed off to private medicine, hospital and other places. Leaving the current health department, there's more preventive medicine. We have programs against smoking and programs against STDs and programs against, it's more of a preventive health kind of thing now and less direct services. Public health is actually suffering from its own success. People don't think about public health. They just take it for granted, kind of like motherhood. As long as the diseases aren't currently affecting anybody, nobody pays much attention to it. And so our public health establishment has been kind of deprecated. It's losing funding. It's losing political clout. Losing all the things that made it successful because it was successful. And now one of the goals of public health is to kind of reawaken people's understanding of public health. And it's hard to do that.
Yeah.
Because it's not one of the things you want to think about.
How would you do it?
Well, just like this. You just have education is basically what it amounts to. There have been a couple of movies and TV shows and things like that to try to bring public health back into the consciousness of people. But it's just so many things occupying our consciousness that thinking like public health isn't there. It isn't something. It's not sexy. It just doesn't rise to that level.
What are some of the things that our public health department is doing to bring more awareness?
We currently are working really hard with tobacco education. I mean, tobacco has been a good public health measure because it's pretty clear that it is a problem. I mean, regardless of the tobacco industry's protestations, it really is a disease-causing and death-causing problem. It's easy to control, relatively speaking. I mean, you can't really prevent people from smoking, but one thing you can focus on. So tobacco prevention has been one thing, and it's been pretty successful. I mean, the rate of lung cancer deaths has gone way, way down. And you still see people who are lungers, the people with advanced emphysema. There still are some of those people, but they aren't like they used to be. You don't have emphysema deaths like there used to be. Kids, for whatever reason, continue smoking. They take it out of contrariness. And other measures, we have a harm reduction program focused on fentanyl and other opiates. That's an interesting situation. When that started, there was a lot of pushback against it. People thought that doing anything to help addicts was enabling their behaviors. You shouldn't do it. They should just be left to die, I guess is what they thought. But there were a couple of public health nurses here we started a harm reduction program here. Rather than try and cure the problem, you reduce the harm that it causes, which turns out to be a much more sensible approach. If you can keep people from dying of overdoses, you can make them live long enough to maybe eventually decide to become sober. But you can't get sober people out of dead people. So the first thing to do is reduce the harm. And they did that in several ways. One was to do needle and syringe exchanges, because a lot of the harm in opiate use came from the injection process. People would share needles, they would use dirty needles. Just a lot of contamination got into the stuff that they were using.
Yeah.
So anyway, the needle exchange got rid of that. It hasn't been until just recently that the government has funded treatment programs that have been actually reasonably successful. But anyway, that harm reduction is another program that we do. Just general nutritional education programs, trying to work through WIC, for example, and working with the school health programs to give some idea of what a nutritious diet might be. Forever, the public health has been involved in sanitation. You don't see epidemic disease, waterborne disease, because we have sanitarians and they do a good job. People complain because they get inspected, but most people understand that keeping things clean is useful. So the environmental health programs are helpful.
What are you proud to have worked on here in Clatsop County?
I think the harm reduction thing has been my major focus in recent years anyway, because it is so theoretically treatable. I mean, you simply don't have to have people dying of overdoses And you don't really have to have epidemic disease caused by all these people who are not taking care of themselves and getting infectious diseases and spreading it on. It's a public health problem, not just private health, because these people are dying, yes, but they're also bringing infectious diseases back into the larger society. So any attempt to reduce that harm is helpful for the larger society. So I think that public health has been in the forefront of doing that. The jail has been very effective under Sheriff Phillips, and the jail crew have been extremely helpful in promoting this harm reduction process and promoting treatment in the jail, combined with CBH to provide treatment after they get out of jail, to provide peer support groups. In the last 10 years or so, public health has become less and less attractive to the public because of polarization, really. Again, a political issue. That can't last. I mean, it's going to happen that people realize that they have to take public health measures if they want to have complex society. If you're going to live in cities, you've got to have piped water and sanitation, clean air, and sensible people who don't make messes everywhere. And if you can do that, then you're going to have a vibrant, healthy city. If you let those things fail, it's all over. Cities will die.
You were obviously part of Clatsop County public health during COVID.
COVID was a real difficult thing because we have not, in our collective memories, some people remember their grandparents might have died from flu in 1917. But we haven't really had an epidemic disease for a very long time. And people have been led to believe that infectious disease, or disease in general, is something that the medical profession will cure. You get sick, you go to the doctor gives you some medicine, and you get better. For a lot of things, that's true. But for diseases like COVID, it's basically new. Nobody knew what this was. It became clear after the first year or so that droplet spread was the way it was going, and not touching things. You couldn't really get COVID from touching somebody or being around somebody. You got COVID if you were in a place where they were spreading droplets, like singing. But in the early days, it wasn't clear whether masks were helpful or not helpful. That became some sort of a polarizing issue. It wasn't clear whether sanitizing your hands was a good thing or not. But that became another one of these issues. Over time, it was worked out. As a society, we didn't understand that doctors were not infallible. Science is an ongoing process of advancing hypotheses and seeing if they're true. Does this work out? But it's not, you don't look into a textbook and find out how to treat COVID because it had never been treated. So it took a while to resolve that. Again, the public health system had shot itself in the foot by being successful. They weren't successful this time. They made some mistakes early on. And then people said, well, you screwed up. There was no understanding of the fallibility of modern science.
Yeah.
Subjective notion here, but looking at it objectively, crowd control mechanisms, to the extent of wearing masks in crowds, is helpful in reducing the droplet spread. It doesn't cure the disease. It doesn't prevent the disease 100%, but clearly decreases the spread of a disease in a crowd situation if people will wear masks in that situation. A lot of antivirals have been developed. Almost all of them have been miserably poor in terms of effectiveness. Antivirals in general don't work very well. It's pretty hard to kill a virus. So there's work ongoing, and there are medical treatments for this, but that's not the principal way you control that kind of a disease. Anyway, I feel pretty good about the direction that public health has taken in this county, and I feel good about the support that we've gotten, specifically in special fields that are very important. I feel discouraged about the national public health response. I hope that that's transitory, that people come to their senses. But locally, I think we're in good control, and we have a good public health establishment here.
Well, now that you are retiring, what are you going to be doing?
Well, everybody says the same thing. I'm going to spend more time with my grandchildren. I have 4 grandkids they're in college now, but in Hood River, 2 girls who each have 2 kids. Hood River is not that far away, but with the constraints of private practice and all the other stuff I've been doing around here, I hardly ever get to Hood River. Plus, they're very busy. So now I think we're going to spend more time.
Sounds good. Is there anything else that you wanted to mention?
Well, let me say this. There are communicable disease threats out there ready to jump whenever our guard is down. And in the past have, by and large, been controlled by public health measures, not by modern medicine as such. Not that modern medicine isn't useful. It's just that major diseases that cause major epidemics of life-threatening disease are best controlled by preventive measures and other public health measures. That's kind of the message that I want to get across, is that public health is vital to a healthy society. And if it's too much politicized, if it's polarized, it can't work. And if you can't have public health, you can't have a vibrant society. The thing that I appreciate about this job is it allows me to get inside of things that I couldn't possibly do as a regular doctor. And it's an extension of physicians. But since I'm basically at core a sociologist or an anthropologist, and medicine is an extension of that rather than the other way around, environmental health and communicable disease are really important. And this organization here, not because of me, but I've helped in some ways, have been very successful in suppressing any incipient epidemics or mini epidemics of disease. I just really feel good about being able to have been a part of these different communities, like the jail community, getting to know the jail doctors, the jail deputies and the staff, and getting to know the AICs, the adults in custody.
Thank you so much for talking with me.
You're welcome. It's been a pleasure talking to you.